Hello, everyone, my future nurses. For today, we are talking about rest and sleep. So, at the end of the discussions, every one of you able to explain the physiology and function of sleep, identify the characteristic of non-rapid eye movement and rapid eye movement sleep states, describe the variations in sleep patterns throughout the lifespan, identify the factors that affect the sleep, describe the common sleep disorder, identify the components of a sleep pattern assessment, and lastly, describe the interventions that promotes sleep. First one, we need to identify rest. Rest that is diminished states of activity, calmness, relaxations without emotional stress, freedom from anxiety. Ulitin natin, pag sinabi nating rest, that is relaxation without emotional stress. And now let's proceed to the meaning of sleep. So when we say sleep, that is a cyclical physiological process that alternates with longer periods of wakefulness. And sleep-wake cycle influences and regulates physiological functions and behavioral responses. We all know that sleep is the basic human need. It is a universal biological process common to all individuals. So human spend or us spend about 1/3 of our lives asleep. We require sleep for many reasons. So number one reason, to cope with our daily stresses, to prevent fatigue, to conserve energy, to restore our mind and body, to enjoy life more fully. So our sleep enhances daytime functionings, and it's vital for cognitive, physiologic, and psychological functions. We have the circadian rhythm, also known as journal. In circadian rhythm, that is a 24 hours day and night cycles that influences the patterns of our major biological and behavioral functions. So pag sinabi nating circa, that means about, and dies means day. So the suprachiasmatic nucleus nerve cell in the hypothalamus control the rhythm of our sleep-wake cycles and coordinate with this cycle with other circadian rhythm. So these are the factors affecting our circadian rhythm: the light, the temperature, the social activities, the work routines, and many more. Sleep regulations. In sleep regulations, historically, sleep was considered a state of unconsciousness. More recently, sleep has come to be considered an altered state of consciousness in which the individual's perceptions and reactions to the environment are decreased. So, the cyclic nature of sleep is thought to be controlled by the center located in the lower part of the brain. So the neurons with the reticular formations located in the brainstem integrates sensory informations about from the peripheral nervous system and relay informations to the cerebral cortex. So the upper part of the reticular formations consists of a network of a sensing nerve fibers that called reticular activating system, which is involved with the sleep cycles. So an intact cerebral cortex and reticular formations are necessary for the regulations of the sleep and waking state. So researchers believe that the ascending reticular activating system located in the upper brainstem contains special cells that maintain the alertness and wakefulness. So yung ating reticular activating system receive visual, auditory, pain, and tactile sensory stimuli. So sleep that is involves of sequence of physiological states maintained by highly integrated CNS activity. It is also associated with the peripheral nervous, the endocrine and the cardiovascular, respiratory, and muscular system. Sabi nga kanina natin, hypothalamus and the reticular activating system has maintained a state of wakefulness and mediates some state of sleep, while in the hypothalamus, that is the major sleep center of our body. So it secretes hypocretins that promote wakefulness and rapid eye movement. So there is a prostaglandin, D2L, tryptophan, and growth factors to control the factors or control the sleep pattern. Okay, this is the physiology of sleep. We have the reticular activating system and serotonin. So in reticular activating system, that is maintains a wakefulness and mediates some stages of sleep. So sleep is an active process involving the RAS or reticular activating system and a dynamic interactions of our neurotransmitter. And serotonin, that is a major neurotransmitter associated with sleep. So it derived from its precursor tryptophan, that is a naturally occurring amino acid. It decreases activity of reticular activating system, thereby inducing and sustaining sleep. So other than that, other neurotransmitter, we have acetylcholine and norepinephrine appear to be required for our REM sleep cycle. There are theories of sleep. We have the active theory of sleep and passive theory of sleep. Pag sinabi po nating active theory of sleep, that is a proposes that there are center that cause sleep by inhibiting other brain center. While passive theory sleep, that is a state that the RAS of the brain simply fatigues and therefore becomes inactive, thus sleep occurs. Okay, the stages of sleep. So, in stages of sleep, different brainwave muscles and eye activity is associated with the different stages of sleep. So, in a non-rapid eye movements, sleep occurs when the activity in the RAS is inhibited. So, about 75% of sleep during a night is NREM or yung ating non-rapid eye movement sleep. So, in non-rapid eye movement sleep was previously divided into 4 stages. So that first one, we have the stage 1. In stage 1, that is a very light sleep and lasts only a few minutes. During this stage, the individual feels drowsy and relaxed. So, eyes roll from side to side and the hearts and respiratory rates drops slightly. The sleeper can be readily awake and may deny that he or she was sleeping. So there is a low voltage of brain waves are noted in the stage 1. In stage 2, the stage of sleep during which body processes continue to slow down. So the eyes generally is still, the heart and the respiratory rates decrease slightly, and the body temperature falls. So the individual in stage 2 require more intense stimuli than in stage 1 to awaken, so such as touching or shaking. While in the stage 3 is the deepest stage of sleep, so different only in the percentage delta waves recorded during 30 seconds and respiratory rates drop to 20 to 30% below those exhibited during the waking hours. So the sleeper is difficult to arouse, so the individual is not disturbed by sensory stimuli. The skeletal muscles are very relaxed, reflexes are diminished, and snoring is most likely to occur. So this is this stage is essential for restoring energy and releasing important growth hormones. So yon. And also in the non-rapid eye movement, that is a sleep progressed through the 4 stages. Sabi ko kanina, typically 90 minutes sleep cycles. There is the quality of sleep from stage 1 through stage 4 become increasingly deeply. So in stage 1 and stage 2, that is a lighter sleep, person is easily aroused. And stage 3 and 4, that is the deeper sleep. So that is slow wave sleep. Okay, so ito yung in-identify natin kanina from stage 1 to stage 2 in non-rapid eye movement stage. So, in stage 1, stage lasts for a few minutes. Lightest level of sleep, there is a decreased physiological activity begins with gradual fall in the vital signs and the metabolism. So, the sensory stimuli such as noise easily arouse a person. And when awake, person feels through daydreaming has occurred. So yan po yung ating stage 1. While in stage 2, it lasts for 10 to 20 minutes. So it is a period of sound sleep, relaxations progresses, body functions continue to slow, and arousal remains relatively easy. So in dito sa stage 2, there is light sleep, eyes are still, heart and respiratory rate decrease slightly, and the body temperature falls. Yun yung sinabi natin kanina. In stage 3, that is last for 15 to 30 minutes. So it involves the initial stages of the deep sleep. And then the muscles are completely relaxed. Vital signs decline but remain regular. And sleeper is difficult to arouse and rarely moves. So in stage 3, there is a domination of PNS. And then the body processes slow further. And sabi nga natin that is difficult to arouse. While in stage 4, that is approximately that 15 to 30 minutes. So this is the deepest stage of sleep. If sleep has occurred, so sleeper spend considerable part of night in this stage. So vital signs are significantly lower than during waking hours. And this is very difficult to arouse. So yun yung tingnan natin. So also in stage 4, there is a decrease of blood pressure, respiratory rate, pulse rate, and temperature. And also in stage 4, there is a decreased metabolism, brain waves, and muscles relax. Okay, and then the other one, we have the rapid eye movement sleep. Ito naman po yun. So, stage usually begins 90 minutes after the sleep has begun. The duration increases with sleep cycles, an average of 20 minutes. Vivid, full color dreaming occurs in the other stages. And stage is TP5 or fluctuating BP, loss of skeletal muscle tone, and increase the gastric secretions. And this is the difficult to arouse a sleeper. In this phase, at the end of the sleep cycles, the eyes are appeal roll, close to wakefulness but difficult to arouse, dream state of sleep, and then the sympathetic nervous system dominates, and also flow of gastric acid increases. It restore a person mentally learning physiologic adaptations, and also here the memory. So the sleeper reviews the day's event and process and store information. So yan po yung ating rapid eye movement sleep. The function of sleep, para mas lalo natin ma-differ, maintindihan yung NREM natin at saka yung REM. Pag sa NREM o yung nating sleep contributes to the body tissue restorations. While in REM naman mga anak, increases in synthetic process in the brain. Okay? Huwag kayong malilito. Okay. So there are different common sleep disorder. In number one common sleep disorder, we have the insomnia. So yung insomnia natin, that is a symptoms that the patient experience when they have chronic difficult falling asleep, frequent awakening from sleep or short sleep, or non-restorative sleep. So, other signs and symptoms, sabi ko nga, that is difficulty falling asleep, waking up too early or frequently during the night, difficulty returning to sleep, waking up too early in the morning or unrefreshing sleep, daytime sleepiness, difficulty in concentrating, irritability, difficulty at work or school, and difficulty with personal relationships. So, in insomnia, there is associated with the poor hygiene or practices a patient associate with sleep. So, anong pwede natin gawin? The treatment, it should be sleep hygiene measure, biofeedback, cognitive techniques, and relaxations techniques. So, there is also, kinakuha natin na in insomnia, there is a behavioral treatment. So, start with natin with the stimulus control that is creating a sleep environment that promotes sleep. Pwede rin cognitive therapy. Yung cognitive therapy natin, that is a learning to develop a positive thoughts and beliefs about the sleep. And then we have the sleep restrictions, limiting time in bed in order to get sleep and stay asleep throughout the day and night. So that is for insomnia. Punta naman tayo sa narcolepsy or tinatawag nating sleep attack. In narcolepsy or sleep attack, that is the dysfunctions of mechanism that regulate sleep and wake states. So this is the overwhelming sleepiness or uncontrolled REM, yung ating rapid eye movement. So in narcolepsy, that is the disorder of excessive daytime sleeping caused by the lack of the chemical hypocretin in the area of the CNS that regulates sleep. Okay? And then we have sleep apnea. In sleep apnea, that is a disorder characterized by the lack airflow through the nose and mouth for the periods of 10 seconds or longer during sleep. So, periodizations of breathing and the characteristic of snoring. So, in sleep apnea, characterized by frequent short breathing, pauses during the sleeps. Although all individuals have occasional periods of apnea during the sleep, more than 5 apneic episodes or 5 breathing pauses longer 10 seconds per hour is considered abnormal. Okay? So, ulitin natin yung insomnia, hindi makatulog mga anak ha. Narcolepsy or sleep attack, ito naman yung excessive daytime sleeping, sobra-sobra sa pagtulog. Okay? Or daytime yung kanyang sleeping. Okay? And then sleep apnea naman, ito naman yung frequent short breathing pauses during the sleep. So parang tumitigil yung inyong paghinga habang ikaw ay natutulog. So that is apnea. So kapag may sleep apnea, that is 10 seconds or longer during the sleep. Next one, we have the hypersomnia. So, ito namang hypersomnia naman, that is excessive sleep, daytime or nighttime. Okay, that is related to physiological problems, CNS damage, and metabolic disorder. In hypersomnia, that is refers to a condition where the affected individuals obtain sufficient sleep at night, but still cannot stay awake during the day. And we have also the sleep deprivations. So the problems many patients experience as a result of dysomnia. So causes include symptoms caused by the illness, emotional stress, medication, environmental disturbances, variability in the timing of sleep because of the shift of work. So that is sleep deprivation. Okay? So, hypersomnia, excessive sleep, nasosobrahan ang pagtulog. It's either morning or night. Sleep deprivations, ito yung walang tulog or can stay awake during the day. Okay, another common sleep disorder, we have parasomnias. In a parasomnias, that is disorder of arousal. So that is behavior that may interfere with sleep and may even occur during sleep. So it is characterized by physical events such as movement or experiences that are displayed as emotions, perceptions, or dreams. Okay, punta tayo sa mga different terms. We have somnambulism, that is sleepwalking. Okay, naglalakad habang natutulog. And then we have the night terrors. In night terrors naman, after having a sleep of few hours, the child bolts upright in bed, shakes and screams, appears pale and terrified. So in night terror, also known as sleep terror, it is a sleep disorder causing a feeling of terror or dread, and typically occurs during the first hour of stage 3 and 4, non-rapid eye movement sleep. So, sleep terror begin in children between the ages of 3 and 12 and usually stop during adolescence. In adults, they may also commonly occur between the ages 20 to 30. So, the frequency and severity vary between the individuals. The episode can occur in intervals or days or week but can also occur over. So, yung night terror natin seems similar to nightmare. So, parehas lang sa parang bangungot. But it's far more dramatic. So, night terrors can be alarming but are not usually cause for a concern of sign of medical issue. Okay? We have nocturnal enuresis. Nocturnal enuresis, that is bedwetting. We have soliloquy, or guys, that is sleep talking. We have nocturnal erection, that is wet dreams, usually experienced by the adolescent male. And then we have the bruxism, that is at clenching and grinding of teeth during the sleep. Ayan. So these are the common sleep disorder. We have the parasomnias, night terrors, nocturnal enuresis, soliloquy, nocturnal erections, and bruxism. Okay, the normal sleep requirements and patterns. So, ito naman yung mga normal sleep and requirements. So, kapag neonates, that is up to age of 3 months, the average about 16 hours sleep a day. So, sleeping almost constantly during the first week, okay, for the neonates. In infants, usually develop a nighttime pattern of sleep 3 months of age. Several naps, daytime, sleep average of 8 hours during the night, and daily 15, total daily sleep, that is 15 hours. Okay, so the average for our infants, that is 8 to 10 during the night. So total daily sleep of 15 hours. In our toddlers, that is the age of 2, usually sleep through the day or through the night and take the daily naps. So total sleep average, that is 12 hours a day. Preschooler, the average sleep, that is at least 12 hours at night. For school age, that is 6 years old, 11 to 12 hours nightly. For 11 years old, that is 9 to 10 hours. For adolescent, a majority takes 7 hours of sleep or less per night. For young adults, that is average of 6 to 8.5 hours. For middle adults, the total amount of sleeping time decreases. And then the older adults awakens more often during the nights and it takes more time to fall asleep. So these are the normal sleep requirements and patterns from neonates to older adults. Okay, these are the factors influencing the sleep. We have the drugs and substances, yung lifestyle natin, usual sleep pattern, emotional stress, the environment, exercise and fatigue, food, and caloric intake. So these are the factors influencing our sleep. And then we have the nursing interventions to promote sleep. Number one, we need to have the helping nurse-patient's relationship. So magbibigay po tayo ng mga nursing interventions to help our clients that has the difficulty and sleeping. Also, we need to promote comfort and relaxation. So, syempre, kailangan po natin ng comfort and relaxation so that our minds and soul and our body has to regain energy. And then, create restful environment. So, kailangan po natin ng maganda at maayos na paligid so that we can rest and sleep. Attend to bedtime ritual. So, dapat magkaroon po tayo ng bedtime ritual. So, what are the times that we need to sleep? So, yung adequate exercises, at least 2 hours before sleep to enhance the non-rapid eye movement, not immediately before the sleep. And another, we need also to have the high protein food. So, in high protein food, that is to promote our sleep. Observe habit of sleep, periodicity, and wake up time. So, dapat magkaroon tayo ng sleep habit kung ano yung oras ng pagtulog natin at oras ng ating paggising. And then, syempre, sa mahilig sa mga kape at uminom, so i-avoid po natin yon. So, avoid caffeine and alcohol in the evening. So, if sleepy, go to bed. Kung tayo na po ay inaantok, kailangan na po natin matulog. And bed is used mainly for sleep. So, ibig sabihin, hindi po ginagamit ang bed para po mag-cellphone or kung ano-ano man po yung ating gagawin. So, para magkaroon tayo ng magandang pagtulog. Okay? So, that is for rest and sleep. So, now let's proceed for your activity. Answer your book on your knowledge, page 1184 to 1185. That is 1 to 10 items. And after that, take a picture of your answer and submit your answer in our Google Classroom before 12 noon. So that's for our rest and sleep. Thank you and God bless.